Good afternoon, ladies and gentlemen. My name is Wendy Mupako. I am a clinical social worker and a psychotherapist at KidsAbility in Georgetown. This afternoon, we're going to be talking about sharing concerns with parents. And I'm going to give you an overview of what we're going to be focusing on this afternoon. So we will look at effective ways of sharing developmental concerns with parents. Then I'll be giving you guys some tips on how to approach parents when you have concerns that you would like to speak to them about and start that conversation. And then we're also going to be talking about the importance of documenting concerns as well as some of the responses from the parents following your discussion with them. And then we'll talk about partnering with the parents through the evaluation process where necessary, as well as support going forward. However, before we proceed with our presentation, I'd like to just highlight on this disclaimer that the information we'll be sharing here is not intended to substitute medical advice. Should you require any medical intervention, I would recommend that you consult with a qualified healthcare professional who's familiar with you as an individual as well as your medical needs. So, in order to effectively share concerns with parents, I like this statement as an opening for this very pertinent discussion that Stephen Covey speaks about. Seek first to understand, then to be understood. So what this essentially means is you want to understand the parents that you're working with, and you want to understand as well the child, so that when you start having the discussion with them, they will later on understand you, but you need to also understand them from their perspective and what they bring to the table. So it's just really essentially encouraging you to go in with an open mind so that you realize that when you start telling them that these are the concerns, that some of them are not going to jump right up and say, "Oh, we're very happy that you're highlighting this," but they may be hesitant to engage further, or they may not be seeing what you're seeing at school. So again, seek first to understand, then to be understood. So some of the things that we can use is the language. I would like to encourage you to use the we messages, because the we messages speak about collaboration, that we're going to be doing this together, supporting the child, because you spend the daytime with the child and imparting education on them. So the parents need to hear that still will continue regardless of the concerns that you are highlighting. Versus saying that you need to do this and the I messages. So they want to hear the collaboration. We will work together and we'll provide support as best as we can until we get an understanding of how we can effectively support the child. And then it's always important to start and end a conversation with positives, because these are some things that the parents take away. When you start sharing concerns with parents, it can really be nerve-wracking to hear that there are concerns regarding your child's development. And it can be difficult to understand. It can take away hope. We don't know people's frame of references. So you want to really highlight that although we are not, although there may be some areas that the child is still developing that we would want to see more, I would like to highlight that the child is very cheerful, always comes to class with a positive attitude, helps out with packing up. So those are just some examples of positives that you can highlight, and they have to be specific to the child, not just generalized. They have to be stuff that the parents are likely to see at home as well. All right. So I like this picture with the tree, the compassionate tree, because it really highlights stuff that needs to come into the meeting. So aside from the stuff that I'm going to highlight there, you really need to check where you're at as a person before you start engaging in this conversation. You need to be able to hear the parents, to be empathetic, to be present. So aside from considering the parents' time, you also need to consider time that's suitable for you to have a discussion with the parents. So the aim of this is for you to clarify the concerns that you have, for you to share your observations, and in informal assessments or screening that might have been conducted, we'll speak about some of the reasons why that is important. And then you want to explain and provide reasons for the child's behavior or lack thereof. So some of the things you could highlight is that sometimes we would like to see a child maybe regulate themselves a little bit better. So after being disappointed or getting emotional about something, it may take them a few minutes before they're able to calm down or regulate their emotions. So right now we're not really seeing a lot of that, and maybe the child requires an adult support before they can calm down and regulate. And this is something that we wanted to bring to your attention. So you can hear from the way I'm explaining that that can be a little bit different for the parent to receive, because they could even start thinking about some examples they've seen themselves at home. And then you want to talk about the future. They want to hear the next steps. So this conversation is not just about letting them know that we have got concerns and yeah, there you have it. We have told you. You want to talk about what this means going forward. You may want to share some of your experience, because you carry a lot of experience under your belt. And it can be very good, as we spoke about earlier on, the language of we, that we are here to support you and to give you guidance where possible. If you need some recommendations of where to go for further assessments, we'll let you know. If you need any additional support, or if you require us to fill out some questionnaires, we're happy to do that. So talk about the future, the assessments, the evaluation, how much the school, the teachers are allowed to be involved, as well as the support going forward, so that they know. So in some instances, you may inform the parents that after an evaluation, the children sometimes require extra time in school. This is something that we do, so it's nothing out of the usual. So they want to hear the support that you offer, and that can also help them and motivate them to get further assessments done. And like we were talking about just now, the school support, what is available at your school that supports the child's development in regard to the concern that you may have highlighted. So if you've got support within your school setting that supports the concerns you have, you want to really have a breakdown to let them know that in our school we do these kind of things, and then we offer smaller tutorials, or we give a child a smaller room to write their test, or we have a scribe, or they use a digital software. I'm just giving examples, say for instance, where it's cases of dyslexia and a child requires maybe reader support. So you want to share some of the things, because parents might not be familiar with all of this, so do not assume that they know. Really open that conversation so that they can take as much as they can. But I'll talk about how you can phase your information and how you can really talk about the information in that discussion or in that session. So now you're at the round table. You want to share the observations you have had with the parents. If it's a collective, because it depends with your school setting, who typically makes contact with the parents to share some of those concerns. If you are doing parent-teacher conference and you are allowed to share some of those concerns, you want to share the observations you have made, as well as other feedback if there's other observations that were made by other educators that you might need to reflect. And then the observations excuse me, can help to build strong relationships with the parents, because then they are hearing some of the things that you're paying attention to in relation to their child. And it's always important for you to highlight and emphasize that the reason you're all coming together at a table is really for the best interest of the child, and to ensure that the child's development is supported so that they can function at optimal capacity. So it's important to reiterate this, that I would really like for him or her to be able to do this a little bit more, and we believe that should they be exposed to this kind of support services or assessments, that will give us more insight or allow us to provide additional support, so that the parents can really see how the children can thrive once they take the step forward. You also want to give parents an opportunity to ask questions, and they may ask you, so you're telling me that my child is presenting with this kind of concerns, they don't seem to be hearing well, and this is based on you not really being able to see some of these things. So how are you going? Where do we get these services, or who do we go to for these kind of services? So before you come to this meeting, try to be prepared by having the information handouts, the contact details for referral processes, because some parents may require you to provide that kind of support so that they can follow through on certain things. And then the other thing is, as you are sharing the concerns, it's important, like I said earlier on, to speak about the strengths of the child, because that gives an overall picture of how the child is presenting, because they're not only presenting with developmental concerns, they have also strengths that they're exhibiting, and you want to highlight that because that shows the parents that this is a comprehensive observation of their child's development, because you're highlighting both sides, the strengths as well as the concerns. All right. So now, when we are talking about setting this appointment time, you need to ensure that you negotiate the date and time. So I want to give an example. So say you have concerns. Is it something that you just immediately say to the parents in the morning when they're rushing to drop their child and you can see they're rushing to go to work? Then you tell them, oh, by the way, I wanted to let you know that I've got some concerns. Your child is not really speaking much as we would like to see, or they're not really paying attention in class. I wouldn't think that would be the best approach, because it's important to set a date and a time aside so that you can really engage with the parents. And I'll share some of the things that you need to be mindful of, which, if we follow the example that I just gave, would be quite limiting, because you are limited on time. The date might not be so great. Maybe they've got some upcoming commitment that they really cannot be disrupted from, and they're not really paying much attention. So there isn't any value really in you telling them when they're not paying attention and they cannot engage you further. So try to negotiate a date and time. So how you could go about this is really by asking them, Mr. Soren, so good to see you today. Before you rush off, I just wanted to find out if we could set a date and a time for the meeting. There are some areas that I'd like to discuss with you regarding child ABC. So then you wait to kind of get their response. Some of them may want to get right into the conversation. Do I need to be worried? Is everything okay? Is there something wrong? So you want to let them know that we need to just have a discussion. At this moment, everything is going well, excuse me. But there are some areas that I would like to highlight and bring to your attention. So that's why I'm requesting for some time and a date that's suitable so that we can have a discussion and see where we go from there. So that can yield a fruitful conversation. You want to look at a venue. So in this day and age, we are working in the digital space. As you're watching this, you didn't get to meet me. You're watching a recorded webinar, right? So a lot of times parents sometimes opt to speak to their teachers via Zoom or other video platforms, or they may even opt to just talk to you telephonically. So when you're negotiating the venue or the platform where you're going to be sharing this news, you need to be prepared as the teacher, because you may need to upload certain information ahead of time if you're going to be doing a Zoom, so that you can already reference or refer them to certain examples or certain evidence that in this particular case, this was the assessment done for whatever you were looking for. And this is what we saw. And typically a child within this developmental stage exhibits 1, 2, 3, and this is not what we're really seeing in this picture. So that's one of the things we've noted. So you want to have done that ahead of time versus just coming to a meeting and then you're not adequately prepared. If you are meeting in person, you want to secure a venue at school where there's minimal disruptions, where there is enough privacy and the parents can engage with you. Sometimes parents are aware of what's going on, and when you start this conversation with them, you might just be confirming something that they were just really worried about. So a lot of emotions can be evoked by that. So they need the space to really react to the news that you are sharing with them. So do consider a venue that is private, that can allow for them to process the information without any disruptions. And then you want to look at the developmental milestones. So this is important as you are the educator to be well versed with the developmental milestones, because there's nothing as embarrassing as going into a conversation and saying this child is not really presenting with 1, 2, 3, and the parents ask you, so what are they supposed to be exhibiting at that age? And you're like, I don't really know. You lose a lot of credibility. So you want to know your developmental milestones. You want to know the stages of development. What are we supposed to be seeing? What are some of the key things that the child is supposed to be doing at every developmental stage? And then you highlight your concerns. It could be with psychosexual development. A child is now maybe 5 years, 6 years old. They're not toilet trained. They do not seem to be aware at all that they need to go to the toilet. Then you can come and indicate some of those. So you want to do a bit of research and know what you're going to be talking about, because there will definitely be follow-up questions, and you want to have some baseline information about the developmental milestones. One of the things I always highlight is to have somebody that speaks the same language as the parents. So if you, like I said earlier on, get to know the family. So if you know that they speak a certain language and you are privileged to have somebody who speaks that language, it may be worthwhile inviting them to the meeting so that they can assist with translation, because some of the information can get lost if the parents are not able to understand what you're saying because of language barriers. So investigate some of these things and try to put aside time or request support from somebody that speaks the language so that you can engage in a meaningful conversation with the parents. And then you also want to look at having a different approach. Some parents are quite okay for you to have a one-on-one conversation with absolutely no evidence, no screening, no assessments. You're just telling them as it is. These are some of the concerns we are noting, and these would be the pathways for the next steps, and they're happy to oblige and follow your recommendations. And then there are other parents that may struggle with just hearing, with just hearing that this is what you've observed. They may wonder if other educators are seeing the same. So you want to have sufficient facts, you want to have sufficient pamphlets. Again, you are not going to observe a child for a week and then start having this conversation. Do it over a prolonged period of time where you have sufficient knowledge about the child and they are no longer as anxious and much more comfortable to exhibit their typical behavior around you. So give them the information, have pamphlets to show them that this is the chart. Developmentally, they're supposed to be able to do this. Right now, we're not really seeing a lot of this, and this is still emerging. So we're wondering if there's additional support that the child could benefit from. Provide statistics and facts about some of the things that you may have found, that children typically exhibit some of these symptoms at this age, and we thought that could be something to share with you so that you could look into it a little bit more. And as you are having this conversation, observe the parents' nonverbal communication. And also listen for verbal cues. Sometimes parents can really shut down. They can stretch out their hand. I don't want to have anything to do with this. I think you're mistaken. What you're telling me isn't what's going on. And it could be that you have too many children in your classroom. They could deflect. And they may really be in denial about what's going on. So you want to watch for how you speak to them. And I'm going to give you some of the things that you need to be mindful of, because the reason why you're having this meeting is so that something can be done and intervention and support can be put in place to support the child's development. So there's no value in you kind of arguing with the parents and then trying to just do a back and forth. So acknowledge where the parents are. If it's becoming too much for them, you may want to pause and maybe check in another time. You can ask them, I can see that this is really difficult to talk about right now. Perhaps we can schedule another time. Maybe you can consider looking at one or two things for me in the coming weeks, and then at the end of the month we can try to see if we can meet again and see if we can have this conversation further. So you're acknowledging where they're at and you're validating how they're feeling, and then giving them the space to process and really take time to go and see and think around their child's developmental concerns. So with this, I'm sure you may be very well familiar with this phrase where parents may say, I'm sure it's just a phase, or children cry. They may even give you reference of cousins that have also exhibited similar behavioral traits that caught up with their developmental milestones, or that were very difficult in the beginning, but things seem to just settle as they continue to grow. So that may very well be true. but you also want to just navigate some of these things. So I'm going to give you a couple of things to be mindful of that can also allow you to probe further if you want to get a better understanding of why they may be denying certain things or minimizing, in some instances, some of the observations or concerns you might have mentioned. So there could be cultural diversity around child development. So this is something to be mindful of, where parents may say, no, but in our particular culture, we do toilet training for both males and females sitting. So it's not really a problem. We wouldn't classify that as a developmental concern, that the child is not going to the bathroom a certain way or is not going to the bathroom at all. So it's all of those things to really hear and be mindful of, and maybe to ask them follow-up questions to say, when do you, in your culture, or in your religion, when do you normally respond to some of these things? What's the procedure if you need to take this further? So it's important to keep those conversations open, because it shows them that you're interested and you're respectful of the nuances that they are bringing to the table. And then this one, I always want to highlight this, the developmental theories. So you want to look at the different kinds of cognitive development, social learning. It's a wide range, but you want to let them know, because some other children may not be exhibiting attachment, may be quite detached, and you want to highlight. They may have gone through trauma, that you want to highlight to the parents that it seems that the child is exhibiting trauma, and you want to follow up, but you don't want to sound accusatory as well, that, oh, well, you didn't find this out or something. So how are you going to navigate that? You can utilize some of the literature from the attachment theory to let them know that when it comes to attachment, children normally present behaviors like this. And when we see behaviors where they become detached and they express certain kinds of expressions, it could be an indication that they may have been trauma. I would just like to find out how things have been going with them. Have they visited, or have they had somebody in the house or been in someone else's care that is besides you? So those are follow-up questions that are not accusatory, that can allow parents to answer and respond. So be mindful of your social cultural theories, social learning, psychosocial development, what happens between stages 7 and 8 and 9. You want to let them know what happens with adolescents. You want to also let them know what happens with children that are much younger, so that they are familiar with the developmental stages, as well as the developmental milestones that the children are supposed to be showing that they may not be showing. And then be mindful of the parents' stress levels. They may exhibit this already with you in the session. Some may become quite irritable as you're talking to them, and be mindful of that. Sometimes parents can tell you, I haven't really paid attention. It's been really busy at work, or there's been so many changes in my family. I'm recently taking care of a family member that's terminally ill. So you want to hear all of these stress levels, because as you engage with them, sometimes the language or the choice of words that you may use may actually accuse them that they're not paying attention to this, and that they may want to shut that down, and they can become defensive as a way of responding to the way you're communicating with them. So be mindful, pay a close attention. Earlier on, I told you, seek to understand before being understood. So this is what I was alluding to. Seek to understand the whole person, seek to understand the whole family dynamic. Sometimes parents are going through separation, divorce, sometimes there's grief going on, many different kinds of things, changes, transition from different countries, culture shock, ill health of the caregivers, substance use, drinking, many different kinds of things, financial difficulties. So you want to pay attention, because sometimes parents may articulate where they're at, and that can really give you a bit more insight, because the concerns might not just only be related to academic as well as developmental milestones, but it could be related to psychological needs. Children may be going through a lot of anxiety. The children may have become quite withdrawn, or they may be exhibiting depressive symptoms. you name it. So as you are mentioning some of these things, you want to also listen and pay attention to what the parents are saying. In some instances, they may ask you questions about the behavior that they're exhibiting, and they may want to seek meanings and validation from you. So if the child is not socializing, does this mean that my child is going through this? So you also need to be mindful to remain within your scope of practice and not jump to conclude to say this means this. You may have seen this many times and have so many experience with children exhibiting similar behaviors, but it's important for you to let them know that from what I'm observing, usually there's an indication around this. However, I would really like for us to consider an assessment or screening from a qualified professional within this regard, and that will give us more insight and we can take it from there. So find ways in which you can navigate those conversations. And again, it comes back to being more knowledgeable about what you're going to be talking about and understanding the resources that are around you in the community. So we just want to quickly, as we are coming towards the end of the presentation, it's important to invite families to share. So be careful not to just be the one speaking the whole time and not really getting a chance for the parents to share some of the things that they see, some similarities. Sometimes other parents can jump in when you mention something, they quickly say, oh, I see that too when we do this particular activity, so that would be great. But in some instances, you have to actually invite the parents into this conversation so that they can share their observations. So I've just put very basic examples there. You could say to the parents, so tell me, does James look at you when you talk to him? So this could be for a child who maybe was presenting with symptoms of autism spectrum and they're not really paying attention to their surrounding or being aware of the other people that are there or whomever is engaging with them. So then leave it at that and then wait for the parents to respond. Then the parents can say, yeah, sure, they always look at me when I talk to them. And maybe you have contradictory information or there's inconsistencies where you don't see that. And then you can let them know. That's good that you're seeing that at home, because at school we haven't really seen a lot of that. We have to try and get the child's attention by coming down to the child's level and really prompting a bit more before they can maybe notice that you're there and you're trying to communicate something. So they could proceed forward once you give them maybe a concrete example of what you really experience and what you observe. And this other one that says, what do you see when Nancy plays with other children? With this, you could be looking at turn taking, you could be looking at frustration tolerance, just the ability to maybe regulate themselves if they must now get off a swing or stop playing a specific game and let somebody else get a turn. So then you could get a little bit more insight if they experience similar things, and then that can also expand the conversation forward for you. So as we come towards the end, looking at partnering with parents through the evaluation process where necessary. So it's not in the right order. However, my first stop would be the pediatrician or the primary health care. So when we're looking at evaluations and you're trying to refer the parents, I would highly recommend that you refer them back to their primary health care, because the primary health care is going to look at the physical and the developmental health of the child. So sometimes children may exhibit certain behaviors that seem behavioral, but they could be physical health, underlying physical health reason that may be impacting their health and their ability to do certain things. So you want to also be mindful of that. So when you make the referral to the primary healthcare provider, then they will rule out certain health concerns and then focus on developmental health. And from there, sometimes they already do the referrals to the relevant professionals or to the relevant departments for further assessments. And once that has already kick-started, you as the educator, when you're having this conversation, you also need to be mindful of the education system, how it works. So we rely on the educators to kind of point us in the right direction in understanding the schooling system, access to support systems within the school. So in case the parents some of the parents may be very well aware that there were concerns and they were just waiting to see if the concerns they see at home are being identified at school. And once you identify, some of them will be ready to take the next step. But they may ask you a follow-up question around the support and the schooling system. So do a bit of research prior to having this conversation. Find out if there are waiting lists that they need to be placed on as soon as they receive the assessment or evaluation report or diagnosis, and what other support systems are available within the island. And then if a child is diagnosed with a learning disability or requires disability support, you also want to indicate what some of that disability and learning support looks like. And then if it's for psychological support during some emotional distress, we also offer cognitive behavioral therapy. You can refer them to us at KidsAbility, dealing with a lot of anxiety, loss of esteem, low confidence, difficulty regulating emotions. So just a wide range of emotional support that we provide. So you can just let them know that there is support that's available that helps children to learn to regulate themselves and to learn to deal with social anxiety. Maybe the child has become much more withdrawn and not really interacting with any other peers and doesn't really want to do anything, and you're really concerned. So it's good to get a bit more insight. And I'm going to share a few ideas of the assessments that could also point the parents in the right direction. So you can refer them for educational or psychological assessments. These are done usually by psychologists. We've got clinical educational psychologists that provide these assessments, and then neuropsychological assessments that gives you an overview of where they're at and the functioning. It's quite comprehensive, so it gives you more insight and it kind of gives you ideas of what supports to put in place. And in some instances within the school setting, then an individual educational plan, typically referred to as an IEP, is drafted, which speaks to the support. So you can share with them what you guys do within the school setting, and you could even share what you do within the classroom setting, how you support the IEP after having gone through all of this. You could also refer them to occupational therapy. Right now, during the summer, we are offering free occupational and speech and language assessments for the first consultation. So it's good to take note of some of those resources so that you can refer parents for some of these services, because in some instances it can be costly. So once you know about free hearing, free initial consultation, it's good to kind of take the first step and then see how to proceed from there, especially if you're not really sure what exactly is required. So keep yourself informed. It really helps. And then the last bit as we are wrapping up is the support. So we've gone through everything now. Now you know what's going on. So the parents want to know, so what now? I almost want to refer to this as diagnosis, what now? So you as the school, you want to be familiar with your learning support at school. In some schools have got a special education needs coordinator, a SANCO, that provides a lot of coordination, contacts the parents, as well as the multidisciplinary team of professionals that may be involved in the child's care, and collaborate how everybody can come together to provide support for the child. So it's important information to let parents know, because some parents may not be aware that there are such kind of resources and professionals within the schooling setting. And if there is occupational therapy within the school, you want to let them know, or if the child requires, if your school allows for occupational therapists to come, even from private organizations. We do that at KidsAbility. We go and we render occupational and speech and language therapy in some instances within the school setting. So those resources are good for the families to know, so that if they're looking at their schedule, their family system, as we were talking about the stress levels, the parents might not have the resources to leave work and come and get the child and drop them and pick them up. But if they know that there is a particular organization that provides this support and they can go into the school, so then there's no disruption of the school's day, the child's day, they may be much more inclined to take that support on board. And always remember to meet the parents where they are. Be respectful, provide information in bits and pieces, and be supportive to the parents. Really engage with them and be empathetic. And just as we wrap up, I wanted to just leave you with this question. As an educator, I want you to just kind of reflect on this, and you can drop us some comments on our website, on our Facebook. If you would like to engage this further, drop me an email if you would like to converse about this further. So, in the past, have you experienced parents that refuse to seek an evaluation for their child or other support or early intervention services which their child was eligible for? So if you have experienced this, what was your response? And so try to reflect on that experience, and even after having gone through this webinar, try to check, could you do something differently? Is there anything that you could change in the future? Because your line of work, it's inevitable. You're going to see children with different concerns that require you to advocate and speak up. So I'm very glad that you've been attending this kind of webinars and coming to these workshops, because they really enhance your understanding of children, as well as how to engage with the parents to point them in the right direction or provide support as they navigate understanding the needs, what their child requires. So think a little bit around that, and let me know what your thoughts are on the various platforms where you can reach us. So I'd like to thank you so much for attending this webinar. If you have any questions, do not hesitate to contact us. And if you'd like to use this presentation in the future, please request permission by contacting us at KidsAbility on the email info@kidsability.ky. And this is the lovely team we've got other members there as well that are not in the image, but very lovely people on board and offering a multidisciplinary approach to enhancing children's well-being and optimal functioning. So thank you for today, and I wish you a wonderful day further.